Syphilis is not a new disease. It is one of the oldest and most feared sexually transmitted infection. For centuries before modern medicine, syphilis caused severe deformities, mental illness, blindness, and death. Understanding the history helps us to appreciate why early testing, diagnosis, and early treatment are so important today. Origin of syphilis. Where did it came from? There are different theories about the origin of syphilis, but the most accepted theory is Columbian theory. Syphilis was brought in Europe in late 15th century. It likely came from Americans and spread rapidly among European population after global travel increased. The major outbreak was recorded in 1494 to 1495 during wars in Europe. How syphilis got its name? The name syphilis comes from a poem written in 1530 by an Italian physician called Girolamo Francastro. The poem describes a shepherd named Syphilus. In the poem, Syphilus offended the god and was punished with a terrible disease. That disease later took its name and became known as syphilis. So syphilis got its name from syphilus and not from a historical patient, but the literature used to describe the disease. The disease existed before the name syphilis. The syphilis outbreak occurred in Europe in the late 1940s, that is, in the late 15th century. At that time, the disease had different names like French disease and Neapolitan disease. There was no single scientific name yet. The name syphilis was adopted because the poem became very popular in Europe. And again, doctors need a neutral universal name, and the word syphilis avoid blaming or attacking specific countries or group, and it is easier to use in scientific writing. Over time, the word syphilis replaced names like French disease, and it later became accepted medical term for the disease. Syphilis was so deadly, and why? Before the discovery of antibiotics, there was no effective cure, and treatments were dangerous and ineffective. Common historical treatments included mercury, which is very toxic, herbal mixtures, and heat therapy. So many people died from the treatment itself and not the disease. Syphilis often progressed to severe skin destruction, neurosyphilis, that is when the syphilis reach the brain, and cardiovascular collapse. In 1905, the scientists identified the bacterium Treponema pallidum as the cause of syphilis. This discovery was a major breakthrough, and it allowed better diagnosis and targeted treatment research. In 1940s, penicillin was discovered and introduced into clinical use. Then, the syphilis became curable. This led to massive reduction in syphilis cases, prevention of late-stage complication, and reduction of congenital syphilis. Congenital syphilis occurs when syphilis is transmitted from mother to the newborn baby, especially during childbirth. Penicillin remains the drug of choice till today. Epidemiology of syphilis, that is who is affected. Normally, syphilis occurs worldwide. There is higher burden in low and middle income countries and areas with limited access to healthcare. Syphilis affects both men and women, sexually active adolescents and adults, people with multiple sexual partners. It can also affect pregnant women, leading to congenital syphilis. It is not limited to any social class, religion, or profession. Despite effective treatment, syphilis remains one of the major public health problems because of poor awareness, late diagnosis, stigma surrounding sexually transmitted infections, inconsistent condom use, and poor antenatal screening. In recent years, many countries have reported the resurgence of syphilis and congenital syphilis cases have increased in some regions. Relationship between syphilis and HIV, that is epidemiological link. Syphilis so increases the risk of HIV transmission. Co-infection is common, and areas with high HIV prevalence often have high syphilis rates. This makes syphilis control a key strategy in HIV prevention. Syphilis is still a public health concern because many infected individuals can be asymptomatic, meaning that they have no symptoms and they can transmit this disease unknowingly. Untreated syphilis can lead to serious complications and it can affect unborn babies. It is preventable and curable. Syphilis is an ancient disease and it had caused massive suffering before antibiotics. It is penicillin that transformed its treatment. Despite being curable, syphilis is still common today. So testing, awareness, and treatment are crucial here. But prevention is the most important. It can be prevented in pregnant women by regular antenatal screening. So regular antenatal screening is very important when it comes to pregnant women. This is to prevent congenital syphilis, the passage of the syphilis from the mother to the newborn baby. And also, you as an individual can also prevent syphilis by avoiding sexual intercourse, unprotected sexual intercourse, like vaginal sex, anal sex, and oral sex. Vaginal sex is one of the most common ways in which syphilis is transmitted from infected person to other person. Vaginal sex can be from penis to vagina or vagina to penis. So during sexual intercourse, condom must be used from the start to the finish, from the beginning to the end. And again, for access, that is from mouth to genital or from genital to mouth. You as a woman licking a man's penis, you should be careful because it can be transmitted in that way. That is oral sex. And again, for men, when you are licking a woman's private part or licking a woman's vagina or vulva, let me put it in that way, or woman's toto, like you are putting yourself in risk because by licking woman's private part, you may get throat or pharyngeal syphilis, which is very hard to treat and it requires strict adherence to the recommended therapy. So you should avoid giving a woman head or licking woman's vagina in form of sexual pleasure during sex. You should avoid unhealthy practices during sex. For anal sex, you should also abstain from that because anal sex can cause micro tears, increasing the risk of syphilis entry and HIV entry if present. So you should minimize how you prioritize pleasure to protection. So that's the thing. If this video is helpful, subscribe to my channel, follow my page, like, comment, put a comment under the comment section. Let me know your thoughts about this video. Thank you for watching. See you next time.